Dr. Sayeed Khan, could you explain some common nerve blocks you perform here at Dolora Pain Management Associates?
Well, let me go back a little bit and explain to you that when a patient calls on the telephone, we do an initial telephone intake. And from there, the patient makes an appointment. I do a thorough history and physical exam along with the medical assistant. And once I do the history and physical, I explain to the patient what is wrong with them. I review the CD, the MRI, the CAT scan, whatever is available, and I explain to him or her what the problem is that has not been diagnosed in the past. You'll be surprised how many patients tell me that nobody told me what was wrong with me and they were just on pills. I give them the opportunity to discuss with them. I counsel them about not using high doses of opioids, and then I explain to them what kind of injections or nerve blocks I perform. For example, somebody with an acute neck pain after a fall has pain going down the arm. Let me explain that to you on the spine, on the model.
Okay.
So I present the spine to the patient and I explain to them, this is a model of the spine. And it is facing you. It's just like me facing you. And these are the discs. Suppose there are a couple of discs that are bulged or are herniated and pressing on some of the nerve roots, either the right side or the left side. Then what I do is I place the patient face down, run the X-ray machine on top, and do a precise placement of the needle in the epidural space and do what you call cervical epidural steroid injections. Similarly, somebody with acute low back pain or chronic low back pain because of herniation of the discs, like this one, has shooting pain going down the right leg or the left leg, then I place the patient face down under aseptic sterile conditions and run the X-ray machine over them and do a precise placement of the needle, either a transforaminal approach, which is putting a thin needle like this after giving them, of course, anesthetizing the skin. Then I inject a little bit of local anesthetic and a medical steroid near the nerve root, either on the right side or left side, depending, or we can take a interlaminar approach, or I can do a caudal approach, which is right here in the tailbone area. What these injections do is they go and deliver the medications to my patient and calms down the nerve and the nerve root of their inflammation and reduces the intake of opioids and narcotics significantly. The whole idea is to see that the patient is not solely dependent on pain pills and becomes an addict eventually.
Thank you, Dr. Khan.
For more detailed information and to have a personalized attention and treatment plan from me, please feel free to visit the website at www.dolorapain.com. The telephone number is 586-755-4333. We are located at 12434 East 12 Mile Road in Warren, Michigan.